You're watching the Wow Lifestyle Show. We're talking functional foods versus food supplements. Do you know what functional foods are? Have you been taking some food supplements lately? We have our experts here to detail on the topic. We have our pharmacist here, our great pharmacist, Mr. Mponsa. We are glad to have you. Thank you for coming. We also have our senior dietitian, Mrs. Efo, to answer. You're welcome. We're going for a quick commercial break. We'll be right back.
She picked the time. He picked the place. Now their eyes meet. They feel an undeniable attraction, but self-doubt stands between them. Can they break the barrier? With the freshness of antibacterial mouthwash formula with zinc in our best ever close-up toothpaste. Break the barrier. Move closer with confidence. Close-up deep action for 12 hours of long-lasting fresh breath.
Looking for commercial cleaners in Ghana? Then your only solution is Delete Ghana Limited. At Delete Ghana Limited, we supply high quality, professional, comprehensive and cost-effective commercial cleaning services across Ghana. We have the experience, specialized skills and equipment to clean your offices, commercial facilities, retail outlets and shopping centers, estates, schools, sports venues, etc. Other services includes waste management, facility management and road and building construction. Call us now on 020-7756-881. You can also follow us on Instagram at Delete Ghana Limited and Facebook Delete Ghana Limited. For more information, email us on info@deleteghana.com or log on to www.deleteghana.com.
Vaseline Men Extra Strength instantly restores the driest skin, so you can start strong every day.
Stomach pain. He's got flu.
Come, you two. Both of you.
Both?
The illnesses are different, but the problem of both is the same.
Same?
Germs. When germs go from hand to mouth, they cause illnesses like stomachache. And when germs go inside the nose, they cause illnesses like flu. The symptoms are different, but the protection remains the same.
New Lifebuoy with Active Natural gives 10 times better protection from infection-causing germs.
I think a lot of our viewers are wondering what functional foods are. Could you please enlighten us?
Thank you for inviting me to this wonderful program. Functional foods are foods that have extra benefits aside the nutritional factors. They are known to reduce sicknesses, enhance functions, and contribute to prevention of other diseases. So in general, it's not only the carbohydrates, vitamins, and minerals that they have, but they give you other benefits.
Okay. So, Mr. Mponsa, how different are functional foods from food supplements? You are a pharmacist, so I'm sure you know a lot about food supplements. And we are saying that functional foods have extra benefits. We usually think that it's medications that help us to manage diseases and all that. So how different are functional foods from food supplements?
Well, I will first want to greet your viewers before. Well, as the name implies, they are food supplements. Now, food supplements are drugs or manufactured products that contain extracted ingredients like vitamins and minerals, like phytoexcipients, phytoconstituents.
Phytoexcipients, what are those?
Phytoconstituents, extracts from plants. For example, resveratrol.
You're taking us far. Bring us back home.
Okay, so these are products that are included into these manufactured products. Okay. They usually come in the form of tablets. Okay. They come in the form of pills, powders, liquids, and what have you. So yes, they are slightly different from functional foods. These are basically nutrients, amino acids, vitamins put together as a product, or in other words, as tablets, as drugs for us to take.
Okay, does everyone have to take food supplements?
Well, as the name implies again, they are food supplements. So it would only be required when someone has a deficiency in a particular vitamin with a particular nutrition. That functional foods might not be enough to take care of it.
Is it possible that functional foods are never enough?
There can be conditions that will predispose someone not to be able to take everything from the functional foods. Example, someone who is immunocompromised, critically ill at the intensive care unit. The person is going down maybe based on road accidents, the brain or something is injured. The person might need something extra aside the food. By that time, the person might not even be able to eat anything. So without the supplements, we might lose the person. So there is the need for supplements. It has its role.
Okay. You said the person might not be able to eat anything. How is that? It's not as if physically they cannot chew or
they are
unconscious. Okay, unconscious.
There are some that are also conscious that based on the condition, like someone with a tumor in the throat cannot eat very well, so the food is being fed through tube, and with that there are a lot of limitations, so we might have to add some supplement to help the person have the normal balanced nutrients or
other chemicals. Can take the foods, the functional foods, right, in the form that they can take through the tube.
If it's the tube, it's the same functional foods that we prepare, but because the person's state is not a healthy state, so the person, you might even give the functional foods, but the person might not be able to absorb it very well. So, but with the supplement, it has already been prepared in a way. The body does not need to go through a lot to get the benefit from it. So we will add to the person's meal.
The way Zaf is nodding, I think he has something to add.
Exactly. I just wanted to add up to what our dietitian here was saying.
Okay.
At times when the person is found in an unconscious state and we need nutrients or vitamins that will aid faster recovery, definitely we will have to fall on supplements. And I was giving an example, like vitamin B12. It comes in a raw state as cyanocobalamin. But then, if it is found in food supplements, they are partly metabolized, or in a layman term, they are partly digested. I don't know if I'm permitted to use that.
You can use that. Okay. I think that will make an
They are partly digested, and hence, when it gets into the system of the person or whoever is taking it, it starts, its onset of action is faster than using a functional food where that same nutrient has to go through a particular digestion stage before it gets to the methylcobalamin.
Okay. It's amazing. But as senior dietitian, would you recommend food supplements over functional foods?
It depends. I will choose functional food if the person's nutritional status is good. That means the person is able to ingest, digest, and absorb the food that he or she eats without any inhibitions. But if there is any inhibition, like the person has undergone surgery, there is a recession of some of the gut intestines for the jejunum or the small intestines and the large intestines. They all have their sites of absorption. So if the person has undergone a surgery where they've resected these parts of the intestine, then the person will need supplement because there's no site to absorb these nutrients. Okay. So that's why it depends.
Okay, so the preference is subject to the condition or state of the person. How about management of chronic diseases? If it's not at that severe stage, do you think that functional foods would be a better option than food supplements?
If the person has a chronic condition and is able to, I will use those word metabolize or normally make use of the food that he or she eats. I'll recommend functional foods because I know you ask me for the examples, but I will jump to give one example. Like we are asked to eat foods with a lot of fiber. fiber in itself is not a nutrient. It's an extra benefit that our food gives us. So if someone has been diagnosed with high blood cholesterol, I will increase the person's food intake of fiber, because research has shown that it helps to reduce the cholesterol. And it's not going to go through any digestion, because fiber is not digested. So I will give. And another example which I will give...
Maybe we shouldn't give too much examples about recommendation, because someone will, take it out of context and go and use it and say, that dietitian came to sit on TV and said that is not working for me.
That's true.
Hold on with the specific recommendations. I think I get your point. So I guess you agree with what she's saying.
100%. And earlier when she said that it depends. So we can't outrightly say that food supplements are over functional foods or functional foods are over food supplements. There are conditions. If someone is in severe anemia, you would want to go with supplements and then augment with functional foods. Okay. So it depends on the situation, like you rightly said, the condition, the state the person find him or herself, and then we will decide whether we go with supplements or functional foods or both.
Okay. If do you have a practical example where you had to manage a chronic condition with only functional foods and it was effective, versus a condition where you had to supplement with food supplements because of the condition?
Okay. Well, before I get to your question, with the question you just asked, Zaf, I think an example like pregnant women, for instance, every pregnant woman is given folic acid as a supplement, because the body needs more than what you can eat from your functional food. So it depends, it's conditional. In terms of someone with chronic condition being managed on only functional foods, it depends on which level we are starting from. Someone with impaired glucose intolerance, beginning of hypertension, it hasn't gone so far, it's just the early stages. We can use functional foods only. In fact, those who are pre-diabetics, the doctors recommend they start diet first before any medication is given. But if the person is started on medication, we still add the functional foods, because that will help the person not take so much medication, because the functional food too is somehow augmenting and doing the same work as the medication, but still the person might need extra help from the medication. So it's two-way.
Okay. Mr. Ponson, I think, people are hesitant about calling some of these supplements medicines. Okay. Can we really consider them medicines? If not, why? And if yes, why?
What are medicines in general? To some extent, medicines help to make us healthy, whatever the situation is. So where are we getting these supplements from? We are extracting them from these fruits, plants, animals, microorganisms. So yes, at times you hesitate to call them medicine. At times you would call them medicine. It depends on the scenario.
From the pharmaceutical view, can we call food supplements medicines? Because people just call it food, especially, I'll say this especially for those who market these foods.
Yeah.
They call it foods because I think they don't want to portray it as medicine, so you add to your food as food and all that.
If you are taking it from the US point of view, they don't call food supplement medicines. They just
US point of view, what about the Ghanaian?
You see, they classify them as food supplements.
Okay.
They do not call them medicines.
Okay, so in that case, they are in a different category.
They are in a different category altogether. However, if you should isolate iron alone, at a point, iron can become a medicine. So, even the word is not decisive as to whether to call it medicines or food. It's in between. Yeah.
We are going for a quick commercial break. We'll be right back.
When it's game time, we all feel the pressure. That's why we trust GhOne antiperspirant to never let us down. It gives us the best 48-hour protection when the pressure is on. GhOne gives us the confidence to always perform at our best. GhOne, 48-hour protection. It won't let you down.
Release your senses.
I choose to excel, and I choose to feel alive. I choose to create, and I choose to walk my own path. I choose my own future, and I choose my own life. Because it's my choice. Pure skin, my smart choice.
Okay, so we know that most medications have side effects, or I don't know whether I can say all medications have side effects. Do food supplements have side effects?
For sure, every medicine has side effects. Okay. Side effects take different forms. Okay. Someone will be taking a food supplement, and there might be an ingredient in there where the person is allergic to. In that case, the person takes it and experiences allergic reaction in the form of rash, blisters all on the skin, swollen nose, puffy mouth, and stuff.
Okay, so those are allergies.
Those are allergies, and we call them adverse reaction of the drug. Okay. So, yes.
For a particular person, because allergies, it can happen to you, but it may not happen to me. But I think there are some general side effects. For example, there are particular medications that no matter who you are or your state, once you're taking the medication, probably after a length of time, you are the expert, so maybe you can correct me if I'm wrong, you definitely are going to record that side effect.
When we are talking about drugs or some category of drugs, we will talk about side effects, but our focus is on food supplements. And more often than not, you don't have one item in a food supplement. You have about 3, 4, 5, 6, 7, 8. So yes, first thing we usually talk about would be the allergic reaction people would experience. But it varies from one person to the other. Apart from that, there are a lot of food supplements that have some herbal ingredients in there. Yeah, and so prolonged or continual taking of those things can also lead to some liver disease, some kidney diseases. We can also look at it from another point where we have drug-drug interaction, where the food supplement is interacting with another drug the person will be taking, because the person probably did not consult his doctor or his caregiver. So yes, if you are taking a drug, okay, we wouldn't want to mention drugs on the set, but yes, there are some drug-drug interactions that lead to very undesired effects.
Okay, that's good to know. Mrs. Any side effects?
Functional.
I can see that he's hesitant about saying that food supplements have side effects. Functional foods.
Functional foods are supposed to be eaten as part of our meal. If one is doing that, then there won't be any side effect. But like the example I gave, if someone picks it that they said, if I eat a lot of fiber, my cholesterol will go down. There's a possibility that you have a lot of diarrhea. You have constipation if you don't drink a lot of water with it. And as you have diarrhea, you will be also losing a lot of water-soluble vitamins and other, so you'll be deficient in many minerals. So the first thing is, functional foods are not eaten in isolation. If you eat it in isolation, that's when the side effects comes in. Aside the example, the diarrhea I gave, there is also, because it's food, there is something we call anti-nutritional properties with every food. So if you say that, let's say oats, for instance, is good, so I'll keep eating oats. That means whatever anti-nutritional property that oat has, you always be exposing yourself to it.
Fiber binding to iron.
Yes. Yes, you always have those problems. So we always say that it's part of our meal, and it should be eaten in a way that is sustainable and practical.
Okay. Well, thank you for enlightening us.
I just wanted to add something small. Okay, so like you said, you wanted to know whether there is a strict thing like there are adverse effects or not. You see, if you're looking at these food supplements, majority of them, you will see that the constituent, they will tell you daily recommended. So yes, when it comes to food supplements, a lot are coming with the daily recommended ones. So if you are not exceeding them, then you might not be experiencing any side effect. However, if you react to any of the constituents there, whether they are in the daily recommended dose or not, you will still react to them. So yes, functional foods can present with side effects, but it's not always the case.
Okay. Thank you for adding on. All right, so you made it clear that functional foods are supposed to be part of our diet. So does it mean that we cannot take it like we take medication? So for example, someone has high blood pressure and you can combine a couple of foods, make some juice, or a couple of foods, make a serving, maybe take 2 servings of those meals a day. How do you relate this combination?
I will give an example. Like, people know that our spice, Prekese, is known for reducing high blood pressure. So some people are making juice out of it and drinking that alone. Anything you
like
take,
pineapple juice and Prekese.
if you are making it into a juice and it's a part of everyday thing, that's okay. But you see that if whatever food that you have, if it is in a combination form, whatever was or is a disadvantage with one will be an advantage of the other. So you will always be balancing everything out.
And that's when they have to see the expert.
Yes, and it's more practical. If I put my Prekese in my soup, I get the flavor, I can drink a lot of the soup. But if I'm drinking it like medicine, it ceases to be food, and it's a medicine and not any functional food.
Okay. So should we be careful about how much food supplements we take?
Yes, for sure.
Okay.
I would always want to refer to what my dietitian also said. We can focus on iron, we can focus on calcium. They are food supplements, but there are occasions they are prepared alone. And if you are taking too much of it, example, if you are taking too much of iron, you experience diarrhea, and then the consequences she mentioned earlier would all follow. Right. So yes, we should be careful. Apart from that, people just walk into pharmacies to buy supplements without consulting their caregiver or their doctor or whoever is taking care of them. At times, some of the drugs, especially people with chronic diseases, some of the drugs they will be taking might not go with the supplement or an ingredient in the supplement the person is taking. So yes, we have to be careful. Supplement is not like you just always want to go in for. They are food supplements. So only when there is the need, that is when we should go in for.
Great, thank you. Your final words.
All right, we shouldn't just walk up one day and say, I need supplements. Let me go to the pharmacy and get one. I want my skin to be nice. I want to look good. Let's contact our physicians. Let's contact our caregivers before we take these things. But we should be mindful. If people are always telling us that these things cannot harm us, if we take it, even the Bible says too much of everything is bad. So let's always consult our caregivers before we go in for supplements.
All right. Senior dietitian, your final word.
Okay, so as Zaf was explaining with the supplements, when you take supplements, because it's somehow worked upon, its action is faster and it has been calculated. Supplements can result in toxicity, that is too much of it, more than what the body needs, and it's more dangerous than whatever condition for which you are taking the supplements for. So you just don't get up and take supplements. In terms of functional foods, now many people are looking out for functional foods. It's good, but we are supposed to first consider the ones in our locality. It's cheaper, it's fresher, and when it's fresher, then it tastes better. And let's make what we have around us more useful. And whether with our food or whenever we go out, functional foods is the way to go.
Thank you. You're welcome. This has been the Wow Lifestyle Show. So moderation is key, and you need to consult the specialist if you want to know what to eat, how to eat it. You should consult your dietitian or the nutritionist. If you want to know which medications or supplements, your doctor is available. The pharmacist is there to help. So don't just walk into the shops and buy anything that you want. Well, this show is proudly brought to you by Optimum Nutrition Care Consult. We are supported by Comfort Legacy Foundation. If you wish to support a malnourished child, check out our Facebook page and see how best you can do that. We are supported by Noda Hotels. They have very nice facilities here and yummy food. My makeup was beautifully done by Nani J Impressions. Contact them on Facebook for all kinds of makeup. Close Up, deep action for strong and white teeth. Vaseline, hydrating jelly to keep your skin moisturized. Live Boy protects you against 10 infection-causing germs. Wow. Rexona, action speaks louder. Send your feedback and comments to our Facebook handle at ONCGH. See you next week.